I felt the power of storytelling through writing was important, and particularly as it centers on health equity, people who are in power and who have privilege, they control the narrative, not just telling our truth, but really telling the truth about what it takes to achieve and realize health equity here in the United States.
If we're going to move the needle around equity, we have to recognize that there are consequences to what we don't know. And if we're not opening ourselves to someone educating us about those things, we'll continue to not know.
The United States government started off as intentionally inequitable, unquestionably, and then perhaps became unintentionally inequitable. But now it's time for us to be intentionally equitable and to be self-critical.
This lack of just an explicit willingness to embrace and understand that institutionalized racism and discrimination is kind of cornerstone to what we know today as health care and medicine. Whether you're in government or you're in private sector or wherever you might be, identify with those policy positions, the economic or budgetary piece, the human capital, the people, and kind of the programmatic components. Those are like 4 key components that I identify with change.
Diversity officers, no matter where they are, first of all, have obligation to make sure that they are comfortable making other people uncomfortable. Pay attention to who's in the room and who's not in the room, and be willing to ask why.
We have some pruning to do, when it comes to misogyny, when it comes to racism, some of these other issues, we got to cut them. We got to get rid of them. We have to eradicate them. It's a challenging process. It makes us uncomfortable, but guaranteed we come back stronger, more beautiful than we were before. And I think that's a huge opportunity that we share. And I'm looking forward to when we can, really be about that good work.